for you and just going into this, I know you're starting out. What are some of those like things that you didn't realize going into the career? Like you were like, wow, like this is something like I didn't know like before, but now is something that like being in there, seeing it day to day, maybe you wish you knew, maybe something that was a surprise for you.
It would be having to learn how to talk to the patients, but that is something different. Like, you can't just go in and just talk how you normally would unless you've had that patient for a few days, you build rapport between them.
Yeah.
No, that's its own skill that you need to pick up. I like to say, like in nursing school and stuff, you can take all the tests, you can submit all your work, but at the end of the day, you need to have the characteristics to be a registered nurse and actually be the registered nurse at the bedside. And one of the skills is talking to the patients. And so that's something that I'm still working on right now on the job.
Have you ever had to talk to someone who's like dying or like they have like a very like bad like prognosis or whatever? And if so, like how do you deal with that type of situation, like giving someone like bad news?
So I have not hit that in my career yet, but we have to approach all of that with kindness, compassion, and empathy because that patient's going to be there, but not only them, their family. And so when we break news to them, we're going to be with other personnel some of the times, and we just tell them we can't really sugarcoat it. We just tell them, and we make sure that we're there for the family and the patient for whatever needs they need. We have to make sure we listen to them because listening is a big part, because when patients are in the hospital, they're in their most vulnerable times.
100%.
If they are being told when they have to do certain things, their schedule is not what it used to be like. And so
Complete lack of control.
complete lack of control. So we have to be very attentive to whatever is happening in that situation.